Hi everyone, I'm Kathleen McCabe, and I'm really pleased to see such a full room. And on that note, there are some extra chairs over here. Maybe we can kind of pass them around. This is going to be a couple hours, and I hope you'll stick around, so get comfortable. And I'm sorry that there aren't chairs already set up in the back there, but hopefully we can. There's another spot over here. There's a couple over here, so please find a seat and oh, and thank you. Is there anybody here that needs Spanish interpretation? I wish I could say that in Spanish.
Saludos, muy buenas noches. ¿Hay alguna persona que necesite traducción en español hoy en esta noche? Aquí estoy para servirle y tengo dos asientos aquí para que puedan venir. Speak now or you'll lose your chair.
Thank you so much. All right, so we have a really, really tight agenda, and we have organized tonight's meeting so that you all can spend a lot of the time talking to each other and giving us your ideas. So we're going to spend the next half hour-ish on a presentation. There's a lot of information to cover to kind of orient us both to what's happening, the sort of the programmatic and service component of this discussion, and then also the physical space discussion. We're going to have an interactive activity to bring all of those key components together. So with that, I just want to quickly walk through our agenda. I mentioned what we're planning to do, but we're really going to orient us all to the planning process, where we are and where we're headed, provide you all with some information regarding health needs, and sort of give you guys some preliminary concepts that our friends who are the architects and landscape architects have begun to think about as they're translating sort of the health needs conversation and the preliminary data that you all have given us over the last 6 months into space. But then we're going to let you all work that out too. So just a little context here in terms of our overall purpose and sort of where we're headed. Most of you probably know that the Shattuck Hospital is moving from the current campus on the edge of Franklin Park to a building in the Boston Medical Center area called Newton Pavilion. And so our charge here is over the next 6 months, and this process has been going on for about 5 or so months already, is really to think about what does the future use of the campus look like. And some key considerations we're thinking about is sort of phasing in that process. So as the hospital moves, that we're sort of thinking about what are the other services that we can be building out there. Really thinking about the critical public health services that are currently being provided there and planning for a future that includes those. And developing options that sort of take some core elements that come out of this community process and really inform the Commonwealth as they're seeking a private partner to go into what the future use of the campus will look like, sort of inform some core elements of what they're looking for in that partnership. And that's why this is a really exciting time to be part of this, because this is sort of where we get to develop what that looks like. What's moving and what's not? The inpatient and outpatient services that are operated by the Department of Public Health in partnership with the Department of Mental Health and the Department of Corrections are what's moving to the Newton Pavilion. And the timing is sort of is anticipated for sort of late 2021, early 2022 at this point. But there are several programs that are on the campus currently that are not moving, and we're going to talk a little bit about who they're serving and what their role is. But you can see here, I'm not going to go through them all, but there's a number of nonprofit service providers that are providing critical public health services on the campus that are not moving. For those of you that joined us at the first meeting, you may remember that we sort of came into this thinking about sort of several silos of kind of perspectives on the site. And we're really hoping to sort of continue the conversation that we started in Community Meeting 1, and to think about how do we bring all of these various perspectives together and think about the site in really a holistic way, in a way that we can really find opportunities to integrate a lot of these perspectives into the 13-acre site in a way that's meeting sort of the public health needs of today, but also meeting the future public health needs of our communities. So with that, I just want to give you a little bit of some background information about the health needs and services assessment that our organization, Health Resources in Action, did I introduce myself? Okay. So over the last few months, we've been sort of thinking about what are the health needs, both of the folks that are, and services, like sort of thinking about what's happening there right now, and how does the services that are being provided at the site fit into the broader public health and regional landscape in Boston and beyond. And so what we wanted to do is sort of give some guidance as we're thinking about the future use of the campus that's grounded in data and that really is responsive to what we know that's happening right now, and also sort of what we understand about what is happening more regionally. And so we have gathered data from community meetings, from our community advisory board. We incorporated comments that happened at the Commonwealth's previous public process that had happened around supportive housing already, and sort of kind of went through all of that information that we've been finding to really inform this health needs assessment. And so I'm going to give you like a really high-level overview of that, and you can kind of take that with you into the exercise to help you think about it. So some of the themes from the qualitative data that we've heard so far, I kind of put into some broad bucket areas. One is around programs and services, and I think we've heard pretty loudly both within the public, the first community meeting that we had about this process, but also in sort of subsequent conversations we've had with the community advisory board and also with the folks that are providing the services that right there, right now, that we need to be very thoughtful about not having a gap in services. We need to be really planning for what's going to happen at the site, keeping those existing types of services in mind. And so that includes services that are providing mental health services, substance misuse treatment and recovery services, and as well as sort of the homelessness and housing services. And so we sort of framed our programmatic review around those three bucket areas because that's sort of who the campus is currently serving, if that makes sense. But we also heard a lot of other things from you all. Things about the importance of sort of acknowledging and recognizing the history and of the site and the integration and the synergy between both the community and the park, and sort of the opportunity that the site presents in terms of where it sits to provide some additional green space, both to the people that are being served on the site and also to the broader community. We heard ideas come up around safety related both to biking and walking and campus security and traffic and things like that. We heard some really important themes around engaging community, and we're really thrilled that so many people are here to give us their input tonight. And so we've been trying to be really thoughtful about who we're engaging and how over the course of this process. And so I just want to highlight a couple of those. The next slide. There are 5 organizations running 8 programs serving thousands of clients each year on the campus, and these are the folks that will, the services that are not being moved to the south end. And so as we're doing the planning, we're really keeping in mind the critical services that those are providing within our broader landscape of public health. Many of the folks that are being served there are on mass health. Many are homeless already or at risk of being homeless. And many of those programs find that being co-located is quite beneficial, both to their patients and to sort of the way that they operate. And so we're wanted to share that information with you all. I'm going to dig a little bit into the themes from some of the specific areas. We've learned, and it's probably not a surprise to anyone, but substance misuse disorder treatment and recovery, if we're not addressing it, it's quite costly to our systems. For people that are in both the mental health and the substance use recovery systems, they're quite challenging to navigate, and that between sort of levels of care, that's often where people can fall out of the systems, and so that those transitional points in their treatment is quite critical. Similarly, we focused our mental health services needs assessment on people with serious mental illness, primarily because those are the folks that are currently being served at the campus. Like most health outcomes, sort of the distribution of who feels the impact of mental health in this country, it's not equal across populations. And so as we're thinking about who's being served on the population, it's a really important thing. And like the substance use treatment system, accessing these services and navigating through them is quite challenging. Related to housing and homelessness, just to quickly mention that there has been a commitment on the part of the Commonwealth to include at least 75 to 100 units of supportive housing on the site. And so as we're thinking about who will be living there and sort of what is the benefit of the permanent supportive housing to sort of this regional public health landscape, just wanted to highlight a couple things. One that is permanent supportive housing is sort of a critical strategy to solving chronic homelessness. And it's a cost-effective way to find folks, to keep people stable, and especially these people that are in these systems of mental health and substance use services, that often the pathway to stability and recovery rests on having a stable place to live. And so this is a really core strategy at this sort of intersection of mental health and substance use and housing. And as we all know, we live in a very expensive part of the country. Housing in this area is quite hard to come by, and so that's sort of part of the context of why adding supportive housing to the site has been identified as a real opportunity. So just a couple other things to highlight. I mentioned a couple of the gaps, and so there's a real opportunity from a programmatic point of view to co-locate a lot of these services and begin to think about sort of innovative ways to help folks navigate these systems on a site that is in a really beautiful place. And to the next point, oh, well, I'll come back to the next point in a second. Yeah, this is fine. I'll also say, we've been looking beyond those couple bucket areas too, because we've heard from you all about some real interests and needs from the broader community, and not just this subpopulation of folks that I've been talking about to date. And so a couple ideas that surfaced here and that we wanted to bring back to the table as ideas to sort of consider as we're thinking about the future use of the campus are things like childcare and things like workforce training and workforce development and job training, and things that would benefit both the broader community and also the folks that are being treated and are receiving services on the campus. And so there's sort of a co-benefit there as well to keep in mind. And then my last point was just in sort of thinking about the healing nature of a park and the opportunity for people to access open space, that there's really also this sort of synergy in thinking about the opportunity on the campus, both from a programmatic point of view, but also from a broader community point of view, and thinking about, right now, it's a very concrete campus. and that the future of the campus has some real opportunity to incorporate a lot of the ideas that we heard from you all in the last of these community meetings. Things like community gardens and trails that connect between the park and the campus, walking and biking paths and other types of gathering spaces. And so the future use of the campus, I think, as we're going into our exercise, which we'll do in a little bit, there's real opportunity for you all to be creative too about what's your vision for that type of space. So I'll just leave you with one graphic that sort of summarizes where we identify some opportunities. And you all can take this with you as you're thinking about the designs that you're going to hear, the potential concepts that you're going to be introduced to in a minute. But I've sort of laid out some of the opportunities that I just walked through with it, you know, that kind of sum up all of the opportunities that we've identified from the health needs assessment. So that was super quick. We're willing to stick around afterwards. You can certainly follow up about any of the data or sort of the processes that happen, but we also want to make sure that you have time to digest and hear this and then spend a lot of this meeting doing the fun work together. So with that, I'm going to turn this over to the other Kathy McCabe.